Hello everyone, welcome to my channel. Today I will be discussing the National Rural Health Mission, which was launched in 2005 by the Government of India to improve the healthcare services in rural areas. So first of all, we will discuss the introduction. National Rural Health Mission, also known as NRHM, was launched in 2005. इसका जो मेन एम था वो था प्रोवाइड करना एक्सेसिबल, अफोर्डेबल एंड क्वालिटी हेल्थ केयर टू रूरल पॉपुलेशन और मेनली फोकस करता था वल्नरेबल ग्रुप्स को लाइक वुमेन, चिल्ड्रन एंड द पुअर। और इट आल्सो एम्फेसाइजेस कम्युनिटी पार्टिसिपेशन एंड प्राइमरी हेल्थ केयर सर्विसेज। और 18 हाई फोकस स्टेट्स थी जिनको स्पेशल अटेंशन दी गई। इन 2013 जो एनआरएचएम था was expanded and renamed as National Health Mission, जिसमें NRHM मीन्स नेशनल रूरल हेल्थ मिशन भी आता था एंड NUHM दैट इज नेशनल अर्बन हेल्थ मिशन। तो नेक्स्ट इज नीड फॉर NRHM। हमें जरूरत क्या थी नेशनल रूरल हेल्थ मिशन की? सो फर्स्ट वन इज पुअर रूरल इंफ्रास्ट्रक्चर। जो रूरल एरियाज थे उनमें हॉस्पिटल इक्विपमेंट्स, मेडिसिन एंड बेसिक फैसिलिटीज लाइक रोड एंड ट्रांसपोर्ट, इन सब की कमी थी, जिसकी वजह से लोगों को हेल्थ केयर को एक्सेस करना मुश्किल था। सेकेंड वन इज हाई एमएमआर एंड हाई आईएमआर। जो मैटरनल मोर्टालिटी रेट और इन्फेंट मोर्टालिटी रेट था वो बहुत हाई था इन रूरल एरियाज। क्यों? क्योंकि देर इज लैक ऑफ प्रॉपर केयर ड्यूरिंग प्रेगनेंसी, डिलीवरी एंड आफ्टर बर्थ। द थर्ड वन इज शॉर्टेज ऑफ trained health workers. There are not enough doctors, nurses, or trained health workers in villages, which affect the quality of healthcare services. The next is rural urban inequality. जो हेल्थ केयर सर्विसेज शहरों में थी वो ज़्यादा बेटर थी गाँव के एरिया से, जिसकी वजह से क्या था, एक बिग गैप था बिटवीन रूरल एंड अर्बन पॉपुलेशन की हेल्थ में। The goals of National Rural Health Mission. The first goal is to reduce the infant mortality rate to 30 per thousand live births, जिसको हम अचीव कर सकते थे by better newborn care, poor nutrition and full immunization. The second goal is to reduce the maternal mortality rate to 100 per 1 lakh live births by ensuring safe pregnancy, skilled health care during delivery and timely medical support. Another important goal is achieving a total fertility rate of 2.1, which is known as the replacement level, and helps in maintaining a stable population. I had explained the replacement level in my previous lecture. Then NRHM also focuses on improving immunization coverage so that all children are protected from severe diseases. It promotes institutional deliveries, meaning delivery should take place in hospital or health centers under the supervision of trained health professionals. So next is the key strategies and components. So first one is ASHA. ASHA stands for Accredited Social Health Activist. She is a community health worker selected from the same village. सेम विलेज और सेम कम्युनिटी से इसलिए ताकि वो इजिली अंडरस्टैंड करे लोकल नीड्स को और प्रॉब्लम्स को। और जो आशा वर्कर थी वो हमेशा फीमेल होती थी, विच हेल्प्स इन बिल्डिंग ट्रस्ट एंड बेटर कम्युनिकेशन, स्पेशली विद वुमेन रिगार्डिंग प्रेगनेंसी, चाइल्ड बर्थ एंड चाइल्ड केयर। शी एक्ट एज अ लिंक बिटवीन द कम्युनिटी एंड हेल्थ केयर सिस्टम। जो आशा थी, शी प्लेज एन इम्पॉर्टेंट रोल इन इम्प्रूविंग maternal and child health and strengthening healthcare delivery at the grassroots level. Second one is strengthening healthcare infrastructure by upgrading sub-centers, primary health centers and community health centers with better facilities, equipments and staff. Then the third one is village health sanitation and nutrition committee. ये काम करती थी विलेज लेवल पे ताकि जो अवेयरनेस है हेल्थ के लिए, सैनिटेशन के लिए और न्यूट्रिशन के लिए, उसको ये improve कर सके. Then the fourth one is NHM improves hospital services through the Rogi Kalyan Samiti, which is responsible for better management, maintenance, and patient care in hospitals. The fifth one is mobile medical units. These mobile medical units are used to provide healthcare services in remote and difficult areas where people cannot easily reach hospitals. The next one is Janani Suraksha Yojana. It promotes institutional deliveries by providing financial support to pregnant women, especially in rural areas. Then the next one is Janani Shishu Suraksha कार्यक्रम. इसने इंश्योर किया कि जो प्रेग्नेंट वुमेन है और न्यू बॉर्न है वो रिसीव करे कंप्लीट फ्री हेल्थ केयर, जिसमें डिलीवरी, मेडिसिन, टेस्ट, फूड एंड इवन ट्रांसपोर्टेशन भी आता था. Then NRHM also focuses on strengthening immunization programs, ensuring that all children and mothers are protected from preventable diseases through timely vaccination. And the last one is disease control programs. It includes various disease control programs to prevent and manage diseases like tuberculosis, malaria, and HIV/AIDS. Next one is role of ASHA worker in NRHM. They provide health education by spreading awareness about hygiene, nutrition, family planning, and prevention of diseases in the community. Secondly, they support antenatal and postnatal care, helping pregnant women during pregnancy and after delivery by guiding them for regular checkups and proper care. ASHA worker also plays a key role in immunization by motivating families to vaccinate their children and ensuring that no children is left unvaccinated. They act as the first point of contact for minor health problems, providing basic care and referring serious cases to hospitals. And they also help in promoting institutional deliveries. Then decentralized planning. Decentralized planning means that healthcare planning is done at different levels. जो village level से शुरू होता था, then block level and then finally at district level. जो village level पे था, local health problems and needs are identified. These are then compiled at the block level and further organized into a proper plan at the district level. एक और important aspect था कि community participation, जहाँ पे local community के local लोग जो थे like आशा वर्कर and village health committees, उन्होंने actively participate किया in planning and decision making. Then funding pattern. जो funding pattern था is shared between central and state governments, where the central government provides major financial support and the state government also contribute and implement the program. Another important feature is flexible funding theme, which means the funds are not fixed for one purpose only. Instead, local health authorities can use the funds according to their needs, such as improving infrastructure, purchasing medicines, or conducting health activities. Next are the achievements of NRHM. One of the biggest success is the increase in the institutional deliveries, where more women are chosen to give birth in hospital, ensuring safer outcomes. There has also been significant improvement in maternal and child health due to better care during pregnancy, delivery, and after childbirth. Another important achievement is improvement in immunization coverage, which helps in protecting children from life-threatening diseases. Additionally, NRHM has led to growth in healthcare infrastructure with better facilities, equipments, and services in rural health centers. So next are the challenges and limitations of National Rural Health Mission. Despite many achievements, there is still a shortage of healthcare staff, especially in rural and remote areas, which affect the quality of services. Another challenge is poor infrastructure, where some health centers still lack proper facilities, equipments, and medicines. There is also a lack of awareness among rural people, so many do not take full advantage of available health services and government schemes. Unequal implementation across states. There is unequal implementation across states where some regions have better progress while others are still struggling. Finally, the last one is overburdened ASHA worker. There is overburden of work on ASHA. So the Rural Health Mission has played a very important role in improving rural healthcare services in India. It has led better health facilities, increased awareness and improvement in maternal and child health. However, there is still a need of continuous strengthening of healthcare system to achieve universal health coverage. Most importantly, community participation remains the key to success as active involvement of people ensures better implementation of the health programs. Thank you for watching.